Question number 3, Barbara Stewart.
Thank you, Mr Speaker. My question is to the Minister of Health and asks, what concerns, if any, does he have about the level of heavy metal in tattoo inks in New Zealand?
Honourable Tony Ryle.
Mr Speaker, under this government at the end of 2011, the Environmental Protection Authority introduced a new standard which sets the controls for tattoo inks, including labelling, safety data sheets, advertising, storage and safe disposal. The EPA also recently developed a voluntary guideline to manage the risks associated with the chemical composition of tattoo inks. I am concerned at the results of a recent Ministry of Health survey of heavy metal in tattoo inks, which found that 9 of 18 brands did not comply with the EPA guidelines.
Supplementary question, Dr. Barbara Stewart.
Is he concerned about the number of young New Zealanders whose back alley tattoos by an unlicensed operator unnecessarily expose them to infections, scarring or even cancer?
Honourable Tony Ryle.
Mr Speaker, the member sounds a warning that people do need to consider. Many people may not be aware that tattoo inks may pose harm from the chemicals from which they're made. Making the results of this survey available will provide useful information for tattoo artists when deciding which tattoo inks to purchase, and also it does provide information for those people who are deciding whether or not to have a tattoo.
Supplementary question, Barbara Stewart.
Thank you, Mr Speaker. Will the Minister put tattoo kits on the list of medical devices in order to restrict sales to only those operators with licences?
Honourable Tony Ryle.
Mr Speaker, the primary response from regulation side at the moment is the Environmental Protection Authority standard, and that standard has voluntary guidance. It's essentially been in for the last 18 months. I think the member raises an issue that's similar to the issue of Celeria. If it's clear that the industry is not responding sufficiently to the voluntary guidelines, then there will need to be another response from the regulatory authorities.
Supplementary question, Barbara Stewart.
Would the Minister consider following Australia's example and introduce an age restriction or parental consent law in order to protect the health of young New Zealanders?
Honourable Tony Ryle.
Mr Speaker, my understanding is I think that Parliament had an opportunity to vote on that in some legislation in the early 2000s and voted against that. I think more particularly on the issue that the members raised quite rightly about heavy metals in tattoo inks, the EPA advises that they're not aware of those being regulated at a national level anywhere else. But what is important, I think, is the fact that people who are considering having a tattoo, they should learn about the various metals that are used in the tattoo procedure.
Supplementary question, Barbara Stewart.
Does he intend to take any action to remedy this situation for concerned parents? And if not, why not?
Honourable Tony Ryle.
Mr Speaker, the Ministry has published the results of its surveys, including the brands, on its website and has made that information available to the New Zealand Tattoo Association, and the association is to advise its members, or they've asked the association to advise their members to use only inks that comply with the EPA guidelines. And the Ministry of Health has also sent the report to the District Health Board public health units in order to inform their work with local tattooists on safety and hygiene. Again, those people who are considering a tattoo should make themselves aware of all the information that is available with respect to any personal safety risks.
Supplementary question, Barbara Stewart.
Does the Minister agree that unsafe practices by the unlicensed tattoo artists, which put New Zealanders at the risk of hepatitis C and other bloodborne illnesses, should be prevented at all cost?
Honourable Tony Ryle.
Mr Speaker, we'd be concerned by unsafe practices by those who are licensed and not licensed. And one of those practices that we and the EPA would like to prevent is the use of these tattoo inks with heavy metals that don't meet the compliance requirement. and that's the reason why we have made those results available and why public health units will be able to use that information to inform their work with local tattooists.
Question number 4, Honourable Ruth Dyson.
Thank you, Mr Speaker. My question is to the Minister of Conservation. How could he say on 17 September 2013, quote, "I did not know that this draft submission even